Why does a month's supply of Ozempic cost nearly $1,000 in the United States, but only around $80 in France or the UK? And it's not just Ozempic. Across the board, Americans pay 2 to 4 times more for the same prescription drugs than people in other wealthy countries. Today, we are digging into why, what drives these price gaps, how the US system works differently, and what might be changing. Hey everyone, welcome back to the channel. According to the latest reports from the U.S. Department of Health and Human Services and RAND Healthcare, prescription drug prices in the U.S. are almost 3 times higher than in 33 other developed nations. When you break it down, it's even more dramatic. Brand name drugs in the U.S. cost over 4 times more than abroad before rebates, and still 3 times more even after the discounts. But generic drugs, those are actually cheaper in the United States than most countries. Generics make up about 90% of all prescriptions filled here compared to only 41% elsewhere. So overall, the US system is a mix of very cheap generics and sky high brand names. Among the G7 nations, the US tops the list. Again, this is not in a good way. Compared to the US, prices are 229% lower in Canada and 347% lower in France. In fact, some of the lowest prices overall are found in Japan and in France. Even for new specialty drugs, the ones for chronic or rare diseases, Americans are paying the steepest prices, and those drugs are quickly becoming the biggest driver of US spending. Let's look at a case study. Specifically, we're going to take a look at Ozempic and its cousin Wegovy, the hugely popular GLP-1 drugs for diabetes and weight loss. In 2025, the list price for Ozempic in the US sits around $936 per month. Now, compare that to Japan, it's only $169. It's $93 in the UK, and it's $83 in France. Wegovy, it's even higher. It's $1,349 in the US versus $328 in Germany and under $300 in the Netherlands. Same product, same manufacturer, wildly different price tags. So, why the difference? It all comes down to how countries handle pricing. Other nations negotiate. Governments like those in Germany, Canada, and the UK sit down directly with drug companies and say, here's what we're willing to pay. The US doesn't. For decades, drug makers have been able to set their own prices, and only private insurers or pharmacy benefit managers, or PBMs as we know them, try to negotiate rebates behind the scenes. But those rebates don't help everyone. They often lower costs for insurers, not the patients. And for drugs like insulin or Ozempic, uninsured Americans might pay the full list price, sometimes 10 times more than a patient abroad. Patents and exclusivity also keep our prices high. Drug companies use overlapping patents, even on delivery devices, to delay cheaper generics. There are some policy shifts that are happening. The Inflation Reduction Act gave Medicare new power to negotiate prices on select drugs, a huge first step, and a 2025 executive order now aims for most favored nation pricing, linking U.S. drug prices to global averages. But experts say even these new negotiated prices will still likely be higher than what countries like France or Japan pay, at least at first. The US leads the world in drug innovation and often gets new medicines first, sometimes a year before they launch anywhere else. But that access comes at a steep cost. As specialty drugs, GLP-1 medications, and biologics keep expanding, the real question becomes, how long can Americans keep paying 2 to 4 times more than everyone else for the same pills? If the goal is to make life saving medicines affordable without stifling innovation, then the next few years will be a real test of whether policy can catch up to the problem. If you found this breakdown helpful, don't forget to like, share, and subscribe. And please drop your comments below. What do you think needs to change to fix the drug pricing in America? Thanks so much for joining me today, and I'll see you in the next video.